Hi, I'm Dr. Galit Talmor.
And I'm Dr. Rafi Romano.
And the subject we're going to address is space dentition. We would like to share with you several cases in which we decide to resolve the case in different aspects.
Either orthodontically, as of course some of you would choose to close spaces.
Or prosthodontically, or a combination between the two of them.
And I think we will surprise you in some cases where the obvious solution will be orthodontics or prosthodontics, and we decided, because of the discussion between the two of us, to choose something which was very creative. We hope you'll enjoy it. The next case came to me, as you can see, I knew from the first moment that this will be a very, very complex case. He has multiple spaces all over, which we need to first stop and do a correct analysis where the spaces come from, what is happening here, what will be our vision, what to do with this case. And I usually in such cases explain the patient that the process of diagnosis will take probably a few weeks for us to know what to do before we can tell him what we want to do in his case.
That's right, and in patients that are asking to improve the smile is everything for them. I often find it very important to consult, to have a kind of a brainstorming as a team, and this is what we often do. And we use every simple software like the DST in order to check the end result that can be created for him. And in this matter, after doing a very simple DST, as you can see here on the right side of the screen, we came to conclusion that there's no other option than go through an ortho method before the actually prosthodontic resolution for him. So we send him over to you, and this is what you decided to do as a first stage.
Okay, so for me the first stage is first of all, I have today the possibility, and we are working in a 3D environment. Everything today is 3D, the simulation, the planning, and we can communicate with each other. So I prepared for Galit and her team, I prepared few options. Whether I should close all spaces, part of the spaces, where I should leave some spaces in the back, should I leave the premolar a little rotated in order to camouflage, not to show all spaces and minimize the prosthetic work later on. And it's very easy for me to create a video where I speak, I send a link to Galit team, and she sits in her team meeting in the morning, and they listen to my video. I don't need to be present, and then I can get their confirmation, their comments, change the simulation, and once I get the plan resolved, plan agreed, then I can execute from the software all my brackets, my wire, to be placed on the teeth in the perfect position, which will give me the result that we have planned in the fastest way. And you know, speaking about speed in orthodontic treatment, I think 80 or 90% depend on the planning, because part of the reason why orthodontic treatment are so long is that we don't plan. And then you spend time on removing the teeth to a different direction. So in this, even that it was lingual orthodontics, we have succeeded to move the teeth to the position that was pre-planned, pre-agreed in a fast way, which was not more than 6-7 months, to prepare the patient to this situation and to give him further to Galit for the completion of the case with some veneers and more aesthetic. As you can see also in this case, as we discussed in one of the previous cases, the shape of the teeth is also problematic. It's not only the spaces. So the patient knew that he need improvement in shape, in color, and in function, because some of the teeth has no occlusal guidance anymore because of the abrasion. So we need to build this occlusal guidance with the prosthodontics.
So with a very simple communication between the two of us, between all of us as a team, actually, we asked for another requirement from Rafi. We asked him to get the incisors a little bit towards the palatal in order for us, the prosthodontics, to be able to stay as preservative as we can be and staying on enamel. We knew up front that we're going to finish this case with porcelain veneers. But as you know, the veneers are sustaining in the best way as we stay on enamel. So by asking Rafi to put the incisors on a little bit towards the palatal, we managed to stay completely on enamel in our preparation. And this is how the preparation looks like, very minimally, although being kept very minimally. The technician had enough space in order for him to prepare for us 5 Emax veneers, which were cemented in a very precise manner under isolation, as you can see. And the harmony between the laterals and the canines was perfect. The harmony between the gingiva and the Emax veneers was very nice. You can see that we managed to create a very healthy gingival situation with the correct support of the papilla, which is very important in cases of closing diastemas.
Now, as you must remember, and this is something I will repeat again, and I repeat it also to my patients, your stable position is the position you have started your treatment, which is multiple spacing and protrusion of the teeth, and therefore the retention is very, very crucial and very, very should be obsessive retention, which means fixed retainer and removable retainer for night. And when we look at the patient in the follow-up, and you can see him around 1 year post-retention, and we saw that tooth number 12 just moved a little bit forward and every time disconnect from the retainer. So I've created, again with my 3D software, I created some movement of this lateral, even some overcorrection. So when the patient wears his retainer at night, he gets some extra pressure on this lateral to keep the teeth in place. And after a few weeks, the retainer becomes inactive and just keep the teeth as they are, again with a good follow-up that we need to all the time see and look what to do.
So the ortho treatment was here as in 2 forms actually. It was the preliminary ortho treatment and the corrective ortho treatment in the maintenance phase, which is okay. We need to know that these are good resolutions, good end result for our patients, and we need their cooperation, of course.
So to conclude, first of all, thank you, Galit, for nice cooperation, not only in this lecture, but throughout the whole years. I think that there is no one answer. And every case that we have presented, I think we can continue the discussion between you, our viewers, and between us. And we must get to a solution sometimes, after a long discussion about every case. I think that if we are focused and all of us are really keen to get the solution for the patient, then eventually whatever we will choose, the patient will gain a lot of benefits out of this cooperation. So I highly recommend, no matter who is your dentist, who is your orthodontist, to go with a very, very team discussion. If you are a patient, just demand to have this discussion and don't think that one doctor can give you the whole solution.
And also keep in mind that there's always a resolution for minding the gap.
See you in our next series of videos in our YouTube channel. Bye-bye.
Bye.